Hello, back again. Sorry, we just had some of you joining. We are about to be joined by Dr. Esther Marban from Clínica Tambra in Madrid, Spain. I was just saying that we will be talking all things male fertility and infertility. They've just written a brilliant article for us all about causes, why men might be infertile or have issues, treatments available, diet, lifestyle, everything that comes with it. And I always feel that it's not always a talked about subject. There's much more emphasis around female fertility, so it's good to be giving it more of a voice. And given I have a husband who is infertile, I like giving a voice to Azuspermia and no sperm. So let's have Dr. Esther Marban join and we can start the conversation. So please jump in with any questions as we go along, and she will be happy to ask. We'll also talk a bit about how it's going since they reopened after this burst of COVID-19. So stay with us. Good evening.
Good evening, just a second.
I think the camera's flipped. There we are.
Okay, right now.
Hi, welcome.
Good
How
evening.
are you?
I'm very fine. How are you? Thank you for inviting us.
Thank you for coming on. I know it's late with you. It's 9 o'clock, isn't it? But
It's fine. It's fine. It's fine. What are you doing it? Yeah.
Good. I've just given a brief introduction about who you are and the topic
Great.
we'll be covering. But if you just want to introduce yourselves and tell us more about what you do at Clínica Tambra, and then we can start talking about the first topic of male fertility.
Okay, great. So my name is Dr. Esther Marban. I've been working for 10 years now in Clínica Tambra. So I'm gynecologist and I'm specialized in human reproduction. So I'm I'm in touch with fertility patients all the days. And I'm doing my job in Clínica Tambra, as I was mentioning before, 10 years ago. I did a master's on human reproduction on the Complutense University here in Madrid. And I'm ready to answer all the questions. I'm really glad to be here today. And hopefully I hope to be able to help all the patients and try to ask all the questions.
Great, thank you. And of course, people will be watching this back afterwards, so it's going to be really useful content for people. And yourself and your colleagues have just written a very, very insightful article, which people can find on the Fertility Help Hub website, all about fertility, which actually went live on Father's Day. Giving a voice to the men out there who are trying to be fathers too. So head to Fertility Help Hub, link in the bio to read that. But let's start by talking about the common causes for male infertility and diagnosis.
Okay, so we are quite used to taking almost every day a sperm test, and it's very important to do a really extended sperm examination, because it's true that sometimes we just start thinking in the women and we don't take care and we don't pay attention to the main factor, and it's really important to take it properly. So the main causes, of course, sometimes we find some alterations in the sperm and we are not able to see or to tell the patient what's what happened before to have that alteration. But we know that some causes, like some toxins like tobacco, drinking alcohol, drinking coffee in a quite high amount and so on, can affect negatively to the quality of the sperm. So apart from that, if the patient is in touch with some kind of toxic because of the work they have or the job they have, sometimes that can affect negatively to the quality of the sperm. Apart from that, it's very common to find some patients that are taking some kind of medicines that may affect to the sperm quality too.
Okay.
So knowing the exact cause to have that alteration sometimes is almost impossible.
Okay. I don't know if you know this, but my husband is infertile. We've got donor conceived children because he has Klinefelter syndrome, which is of course genetic.
Yeah.
I talk about it a lot on here. And so
I know about it.
Oh,
yeah.
You do? Okay. So the discovery.
Yeah. I read about your personal history. Yeah.
Okay. So the discovery was heartbreaking and so difficult, and we were so confused as to why he had zero sperm. and he had the microtesi operation in America. Sadly, it didn't work. But what for people who don't know what azuspermia is, please could you explain a bit more about the obstructive and non-obstructive and what can be done to treat it?
Okay, so the azuspermia means that there are no sperms in the sperm test and in the ejaculate. So the causes are mainly two of them. And we talk about obstructive as azuspermia when the cause is that there is a blockage in the production of the sperms. So the most typical situation, for example, if a man decides to do a vasectomy, it's going to block the tube that is going to bring the sperms to the ejaculate, and it's very obvious to know that there are no sperms in the ejaculate because it's something that had stopped. The way that the way that the sperms has to do, but some others are to. Just a second.
Sorry, I think the camera flashed.
Okay.
There we go. Oh dear, I think the signal's going in and out a bit. I think.
Okay.
We may
have some other alteration is the security for the non-obstructive azuspermia. That means that the alteration is in the testicle itself. So if we have an alteration that is affecting the testicle, sometimes it's quite difficult to avoid or to try to solve that situation because the alteration is in the testicle itself. So, for example, if we have an alteration, if we have an obstructive azuspermia, sometimes we can find sperms in the testicle. So if we do a biopsy of the testicle, we are able to take some sperms, and sometimes they are useful and we can use them to do the IVF. But some others, if we have a really some other alterations, such the secretive azuspermia, it's not possible to find them. So for example, in the problem that your partner had is the typical that some kinds of alterations in the karyotype affect really highly that kind of structure, and we know that it's quite difficult to find viable and some kind of useful sperms in the testicle. So it's very important to do a good diagnosis with the urologist to be able to try to at least give the information to the patient to say, okay, we think that maybe we are going to be able to find sperms in the testicle, but some other times it's impossible. Of course, we can try, but in case it's not possible, we should think about using a donor sperm.
Yes. With my husband, when he saw the urologist first in London, before we went to the States to have his operation, they put him on a course of female stimulating drugs to try and increase the testosterone to see whether that would make a difference. It didn't, because he got tested again before they operated. But I remember having to inject him, and it was a very strange time.
Yeah, alcohol is quite strange because I know that some urologists, when they test some kind of hormones and they see that there's a kind of a disbalance, hormonal, normal disbalance, they try to use that kind of hormones, but at least in my experience, normally they don't work very well because the alteration is so important that they don't have any specific effect on the sperm count and so on.
Okay. And what about people who do have sperm, but they're not functioning in the way that you'd like? What kind of treatment is out there, and what would you suggest?
Yeah. Well, actually, it's quite common to find that, for example, we have a good sperm count, but sometimes the sperm motility is not as good as we need. So in that situation, sometimes it's important to check if there is any infection in the sperm, or in the sperm secretion, because sometimes that infection can affect the motility. So some others, if we don't see any infection, that's quite common to see, we need to try to push that patient to have a healthy way of life, trying to avoid toxics, as I was mentioning before, such as alcohol, smoke, and so on. And it's very important to try to avoid some kind of food and drinks that are very oxidative. So, of course, we can drink some coffee, but we normally recommend not taking more than 2 cups of coffee, because the caffeine can affect to the sperm quality. The same happens with some drinks such as Coke, because we know that Coke, Red Bull, and some kind of drinks can affect to the oxidation of the sperm and can affect the sperm quality. So we try to push our patients to have a healthy way of life, and we sometimes recommend taking some kind of vitamins or antioxidants. And we are quite, we use normally turmeric, because we know that turmeric can reduce the DNA fragmentation, that I'm sure that we will talk about that afterwards. And the sperm quality changes, and we have better results when we try to make things as we should.
And how long is the period that you would suggest that to enhance or to make sperm better quality? Is it 3 months?
Yeah, actually between 2 or 3 months. We know that the sperm needs 2 months to be produced in the testicle, and then afterwards we see it in the ejaculate. So it needs like 2 months. So 2 or 3 months would be the best situation. Sometimes we understand that some patients want to start the treatment as soon as possible, and it's not possible to use such a long treatment. But normally, if it's possible, at least 2 months would be the ideal situation.
Okay. And also, just to say at this point, anyone who's watching, if they've got any questions for Dr. Marban, then please fire them across. I'm sure you'd be happy to answer them. What about age and weight?
Yeah, well, we know that age, like day by day, we have more information about data about the male age, because, well, I think that almost all has been written about the female age. We know more things about that, but day by day they are appearing, and they have been publishing more articles about how affect the age of the father of the baby. So we know that, of course, the age, it's important. It's very important, actually.
For men too.
And actually, yeah.
You're right. Okay.
So, sorry?
Oh, sorry, I said right. That's interesting, because as you said, we always focus on the female age.
Yeah, it's like we just think in the female language, but we know that the male factor and the male age is really important too. The reason is that, of course, let's say that, and let's think that the sperm quality can be kind of good, but the older the men get, the higher percentage of children that may have some kind of problem that we may have. So, for example, it's known that the father's age is related to some kind of alteration in the baby's heart and some kind of autism. Of course, the evidence we have in this moment is not so strong to, of course, recommend in that way, not using the sperm when, for example, the partner is over 50 years old. But day by day, we have like more interest about that, and we have more data in the fact of taking into consideration that the male age is important too. So actually, in our consultation, I'm quite used to giving that kind of information just for the patients to know, not to make them to be worried about that. But it's important to know that, of course, it's important. And they have to know that maybe the children that they may have after the treatment, maybe in the future, they could have some kind of health problem. But in general, the data and the clinical evidence we have in this moment is not very strong, but maybe in the future we can have some other information to give the patients.
So we know a lot about the fact with female age, there's a drop off after 35. And obviously more so going towards 40. What age would you say is the turning point for men?
50.
50.
So 50, 50 is the moment when we know that, of course, the sperm quality and quantity may be like decrease. And apart from that, the alteration that we may find in the babies born from that kind of fathers. But of course, if you like, it's like always, we always say the same, the younger you can get pregnant, the better for you. So in the end, of course, that age is just a limit, but it doesn't mean that it has to happen in all the patients. Of course, it won't, but it's just to have some information about that.
And what about weight? Like if someone has a high or low BMI,
Yeah.
how does that affect men?
The same. So it's not so uncommon to find patients who have quite a high BMI. So we know that some alterations, because in the end, that patient is going to have a higher quantity of fatty tissue in their bodies, and we know that the hormonal alteration they may have is going to be increased. So that hormonal alteration can end and can affect to the sperm quality too.
Okay.
So actually, sometimes if we have a really obese man, we recommend losing weight, apart from other reasons, because it's important, because the sperm quality may be improved if they change the habits normally.
Okay. And I mean, I know the answer to this, but clearly things like smoking marijuana and stuff is not going to be good for sperm
No,
quality.
for sure. That kind of drugs never help.
We talked about alcohol as well. On a positive note, in terms of what people can do to better their health and their lifestyle, what would you recommend? Exercise and a good diet and supplements?
Yeah, of course. I think that if you have a healthy diet, a Mediterranean diet, plenty of vegetables, fruits, and that kind of things, and if you stop, of course, smoking, do some kind of exercise, everything will help. So in the end, it's just considering changing our habits. That sometimes is not so easy, but in the end, it's the best idea.
And in terms of the treatment, obviously, we talked a little bit about azuspermia and the fact that some men might have microtesi surgical retrieval. What are the other treatments that are available for people who have some sperm but not a lot, or as you said, the sperm isn't swimming the way that it should be, or it's a bit slow?
Yeah. So actually, as I was saying before, we normally add some kind of antioxidants or even turmeric to the treatment, trying to improve the sperm quality. And normally the results we have are, let's say, of course, we don't expect to change all the sperm parameters, but we normally have a different sperm count or motility, which is a really important parameter to take into consideration. So in the end, we know that kind of vitamins and supplements may help, and actually they do. Okay. But of course, we need to go further, because sometimes it's not enough.
Yeah, exactly. And so what would that be? Are you able to retrieve sperm with less invasive procedures than the microtesi? And also, I presume with IVF you would perform ICSI, is that right?
Yeah, so as we are using the ICSI in most occasions, so actually I would say that the sperm parameters have to be like really, really bad, so that our biologists are not able to do that ICSI in the IVF cycle. So in case the urologist thinks that it would be better and the result will be better, in case we have we do an testicular biopsy or microtest or so on, we try to do it, but normally we try to be as conservative as possible, trying to use the sperm in the conditions we have.
In Cloud9 has made a good point, saying that we need better education about fertility because there's a lot unsaid. Often people believe that it might be the woman's issue, and I
completely agree.
Yeah, I definitely thought after 6 months of trying with no success that there was something wrong with me. I thought that maybe it was because I had the IUD for years. That might be why. I have a chronic urticaria condition. I thought that might be why. So I was stressing myself about all these reasons why perhaps I wasn't getting pregnant. And actually it was completely male factor.
Yeah, actually I think it's so common to find that situation, because it's like, I think like the women like just think that there's their fault, and I always say there is no fault. So it's just things are that way, and anyone is blamed for that. And well, actually, we know that it's very important to to test both women and men, because we are quite used and we see many patients that has like the woman has all the studies, all the tests completely done, but the man hasn't done anything.
Yeah.
And sometimes, of course, it's like it's a thing of two people. So both of you have to be tested. And sometimes, as you mentioned before, and as you experience in your own situation, sometimes it's just a male factor, and we can solve it, and we can try to put a solution and find a solution for that case, of course.
Absolutely. Someone's also asked if you have any advice to improve a man's morphology.
Well, the morphology is not, well, we know that sometimes that vitamins and so on can improve a little bit the morphology, but it's not so easy.
Okay.
It's true that it's important to say that depending on the laboratory, the morphology can be like, the value can be higher or lower. So if the laboratory that performs the test is a good laboratory, normally the number of normal sperms is quite low, but it's normal to find that. So, but unfortunately, I would say that there are no there are no many vitamins and so on that can affect so much to the morphology. But in the end, it's like, as we are going to do in most occasions, an ICSI treatment, it's very common to find at least, let's say, if we need like 10 sperms, for example, to fertilize 10 eggs, the morphology is, let's say, that can be skipped, because in the end we just need 10 good sperms.
Yeah.
So
Yeah.
in general, I would say that it's not so difficult to find them in a non-very altered sperm sample.
That's good. In Cloud9 has also said that it's not about pointing fingers, it's about treating a condition regardless who is responsible for. Absolutely. And I'm sure you've probably seen lots of cases where there might be a little bit of something on one side and a little bit of something on another.
Yeah.
And
So
it's very much a team
just
sport,
thinking
isn't
in
it?
positive and trying to add positive points and saying, okay, maybe I can improve that part, and maybe the other can improve the other one. So in the end, it's just thinking in positive and trying to help our patients, of course.
Absolutely, absolutely. And I just want to ask whether anyone else has any questions at this point. What I was going to ask before we move on to our sort of second topic tonight was, what are the success rates like for male factor treatments?
Sorry?
Oh, sorry, we lost you for a second. What do the success rates look like for male factor treatments?
Well, it depends. Fortunately, if the women are young, the results are really good, because in the end, if we are able to select a good sperm, as I was mentioning before, if we are able to do a biopsy in the on the test and the testicular, and we are able to get some sperms, if the patient is young, the results are really good. So the opposite happens if the patient is over 40 years old, the result can start decreasing.
Okay.
But in that situation, we are able, and what we are quite used to doing the PGS to the embryos, so the pregnancy rate and the implantation rate will be increased. So in the end, it's like the main factor keeps on being the woman's age. So if the woman is young, the results will be really good. But in case the woman starts to be like not so young, and if the woman is over 40 years old, things will start changing and things will be more difficult to get pregnant.
Okay. Nikita has just joined, and she's asked what you would advise for improving sperm count.
Well, the sperm count, as I was mentioning before, with the sperm motility, may be improved with some kind of vitamins and so on. When I say that it can be improved, I don't mean that, for example, if the sperm count, let's say, is 8 million, it's not very likely to be like 20 million in the second sperm test. But actually, we think that maybe where we see that sometimes we see, for example, if it starts in 8 million, maybe it can be like 10 million, 12 million, that is going to be a bit lower from the range. We normally consider that as normal, but of course it could be better to have that sperm count. In general, both antioxidants and vitamins improve that kind of conditions, the sperm count and the sperm motility, but not in a very high range. Just let's say, and slightly changes can be found, but not a really big difference.
Okay, that's good to know. Thank you. That's been really insightful. And as I said earlier, for anyone who's joined, the team at Clinica Tambra have written a brilliant article covering all of this in a lot of detail, which you can find on the Fertility Help Hub website. The link is in my bio, so check it out. And the other thing that we were going to just touch on was how have things been since you've reopened following COVID-19? What does fertility treatment look like in Spain right now?
Yeah. Well, I have to say that we started working on the 11th May, and where we are working normally with all the safety conditions and all the safety measures that we have to take and we actually take. And first of all, we always measure the temperature to all our patients. We are always wearing masks, and the patients too. We always keep the social distance between patients and doctors and all the clinic staff, and we always test the coronavirus, the COVID-19 before starting once the patient started treatment, and before doing the egg retrieval and the embryo transfer, we always do it again.
Mm-hmm. But correct me if I'm wrong, but your waiting room lends itself well, doesn't it, to distancing?
Yeah, actually, our waiting room is we did some changes some years ago, and they are like completely independent. So some patients can be in one part and the other, and they are not going to be in touch, and they are quite separate. So it's quite useful to have that kind of waiting room, because otherwise it could be difficult. And now we have a nice terrace, and some patients can stay there, and they can drink something until they are going to be attended by the doctors.
Mm-hmm. Brilliant. Thank you for that. Laura has asked,
You're welcome.
We mentioned it just now, but turmeric, what's your recommendation? Mm-hmm. I know that you're not a dietitian, but what's your recommendation in terms of using it as a supplement or part of a diet?
Yeah. Well, actually, we normally recommend taking the supplement itself, because the amount that can be added to the diet is not very high.
Okay.
So normally, I would say that almost all the supplements, pills, will have the same dose of turmeric. And we normally recommend taking at least one pill every day for 2 months at least, if possible 3 months. But I would, in case we need to use turmeric, I would suggest using a supplement, better than just adding it to the diet.
Okay, that's really good to know. Laura, I hope that's answered your question. Great. Well, thank you so much for all of that insightful information. If anyone's got
very
further
welcome.
questions, please message myself and I can pass them on. And equally, if you guys are taking new consults, aren't you? So if you'd like to arrange a consult, you can do that through Fertility Help Hub or directly. And yeah, it's been great chatting to you. So thank you so much. And thanks to everyone who's joined.
Thank you very much. It has been a pleasure for me to be here, and I hope to see you soon.
Definitely. Thanks for your time. Have a nice evening.
You're very welcome. Have a nice evening. Bye-bye.
Bye.